Hello, welcome to NU636 Advanced Pharmacology. This is week one synchronous session. My name is Dr. Christy Burks. We're going to go ahead and get started. As a reminder, this is always recorded. All right, on the agenda this week, we're going to look at the announcements, the APA 7th edition, some tips and tricks there, and just some resources available to you. Look at the syllabus quickly, the unit objectives, the readings, videos, and presentations we have assigned for this week. Of course, we're going to look at some assignments and just go over some tips on that, and then ending with shadow health. All right, on the announcements, let's jump to the pre-course announcement. You should have already looked at this. You've probably already watched the preview course session. This is the only announcement that I would like for you and ask that you once you've watched the pre-course that you do a comment or even just hit the like button on this, just so that way I know that you've watched it. And there's some information in there that is important that you know where to find and get to. So that's why I have you do that. On other announcements, I do not have that as an option. So don't worry about it. Okay. Each week you will receive a welcome to the week announcement, and this is this week's. So welcome to week one. It just goes over briefly the objectives, the assigned reading, videos, and presentations, looks at the assignments that we're going to have due. On week one, I did have the synchronous session. Typically, I do not, because I'll show you on the next slide where it is always located. And then I remind you that my email is available there, and you can always reach out with questions. All right. The important announcement to know how to refer back to is that synchronous session schedule and links announcement. Each week, you'll have to review this announcement. It's very important that you always look at your course. I'd say don't go longer than 3 days is probably the max, at least just jumping in, making sure there's no announcements. Now, you might have it set to where it goes to your email. That's fine. But you always want to make sure that you're reviewing this. If you're joining the synchronous session live sessions, always check here before you come in on that week one or week two or whatever week we're on. If I need to make changes, I will do it here. I'll also typically send out an email or an additional announcement just to give you a heads up. You will also find the link. That's to join the live session. If you're unable to make the live session, don't worry. Once the recording is done through Zoom, I will post the link here. I do have to convert it over to YouTube. I just find that students have less issues with that, so I utilize that as well. But I'll post that usually on the same day, so you can watch it as well. Underneath each week, I do have or include optional journal articles and or resources. This is exactly what it says. It's optional. It's not something that's required or on the test or anything like that or on the quizzes. But I offer this as I come across any great information, patient education tools, additional study things like the medication. I think I posted, let's see, what do I have here? Oh, these are just some journal articles, but in future weeks, I have some calculators or tools like that, additional medication sheets or PDFs to look at as well. Okay. I'm not going to go over this next one because I did so in the preview course session. So I just ask that you refer back to that before you start your discussion or after the grading. Always make sure that you're looking at your instructor feedback. This discussion assignment tips announcement was constructed by all of the instructors and the course lead that teaches this course. So each course is taught by multiple instructors. So we came together. This is what we've agreed upon as the expectations for a discussion. So we utilize the rubric. And if you follow these tips, this will help you out to maximize those points. Okay. All right, just a quick reminder, this is another announcement that comes out on the shadow health focused exams. The reason I do this is because what happens is that students see exam on the shadow health and they think they can only take it one time. You are able to take it multiple attempts. So please understand that because your grade is configured on the Student Performance Index, the SPI score. So whatever percentage you get on that, that is what you take times 40. And that will give you the points that you will receive in the course under this assignment. With that said, on each of these focused exams, a minimum of 75% is needed to receive any points. Anything below that, you will receive zero. So that's why it's important to look at that, maximize your points. Okay. Now, I am going to talk about an option to kind of help you if you're struggling with it, especially in the first week or two on those first couple exams. If you find yourself struggling, they do offer a conversation concept lab that's not required, but it does help you kind of walk through talking to the patient and making sure that you're asking the things in a way that you're going to get credit for them on these exams. Okay. Once you're done, you can go back and review the feedback on that attempt. You do that by looking at the menu on the left-hand side. And when you click the options, it gives you like the subjective data collection, objective data collection, etc. And it will show you what you were asked and where you lost the points on. Now, again, then you can reattempt this assignment as many times as you like, but you want to make sure that you're submitting the lab pass with the highest score in that student performance index score. Okay, so please make sure you're looking at that and making sure that you're looking at that versus those other scores that are on there. And that is the one that you will post in your Canvas submission link. You do have the option to go back to attempt and click reopen at the top where you get the lab pass. Now, when you do this, it will actually bring you back to the activity that where you can actually resume, as well as which it's kind of a good option if you just need to add more, such as you didn't ask enough questions in the history, maybe. Perhaps you didn't follow up on information provided by the patient with a response or related questions, or maybe you just needed to add more education points. Okay. But if your attempt was off in that you were not providing accurate education or not the right prescriptions and had more incorrect information than just missed information, then it's going to be easier to review the feedback and just reattempt it in the activity from the start. So that way, don't just reopen it, because when you reopen it, it saves all of the data from the last attempt. Okay. If you have questions about that, please reach out to me. But I had students before where they're just continuously reopening it. And so they basically were just adding to it, but they had already missed things that were pretty significant. So adding to it was also just muddy in the water. So the reattempt is what they probably should have done. So if you're getting frustrated, take a minute, review your feedback, take a break from it, and then come back to it. Okay. Make some notes and see what you need to improve upon, and then reattempt it. Okay. Usually once you go through this activity that first time and you review that feedback, you can generally complete it a second time and improve your score greatly. So I just wanted to make sure that everybody understands that. The last announcement I was going to talk about is just the resources and how to break down a question. It is just that. I want to encourage you to find, if you already know what type of learner you are, but if not, try and figure out what type of learner you are, and you want to make sure that you're creating study, whether it's a study guide, answering questions, taking notes, creating flashcards, doing a concept map, or do a comparison. Just identify what works best for you, so that way you can actually use it to study whenever you're reviewing the information. Okay. Because remember, you're not just learning this information to answer questions on a test or a quiz. You're also learning this to apply it, to understand it, to apply it in a clinical setting with your patients. Remember, Herzing has wonderful resources available to you if you go to that Student Resource Center course, and that specifically Student Academic Success Center. The library has the 3Ps, which offers 4 additional ebooks, and I go over that as well in the preview course session. And then the last thing just kind of goes over some helpful tips when you're breaking down a question in the quiz if you're finding yourself struggling with any of it. Okay. All right, moving on. This is just a couple tips for the APA 7th edition. As I mentioned previously, that APA style link is a wonderful reference. So it offers all of the information that is in the APA 7th edition, book. So if you don't have that APA 7th edition book, you're okay. I've had students and even myself, I utilize that APA link and it does wonders. So this is an example of the textbook reference. So if you are utilizing the ebook, this is what your full reference should look like. You always want to list a URL or a DOI if it's offered. And I would say 99% of the time, your textbooks will offer some type of URL whenever you're doing the reference. If you have the physical book, this is what your reference should look like as well. When you are doing journal articles or diagnostic manuals, you need to make sure, again, that you have the accurate DOI or URL links. You need to make sure that you have the accurate information, and that includes all of the correct information required for listing a full reference. And that's where you're going to have to go back to that APA book or APA link to make sure that you're including that. The reason I point that out is because if you're not including that correct information, that could be a form of or lead you to issues with plagiarism, because it is your responsibility to list that full accurate information for a reference as well as an accurate citation, correlating citation when you're writing. Okay. This is offered in the APA style link. It's just a common reference examples guide. I do have it as a PDF listed on the synchronous session schedule and links announcement as well, just for your reference. All right. If you remember, the library has some great tools. You can go to the course home button, and on that left-hand side, go under to, or on the home button, and then you'll go to library link there. Once you get there, you go down to that citation help APA style, and you'll find a ton of references and resources for you. They offer that paper formatting, the student references like there, and the in-text citations if you're needing help on that, okay? And then it also goes over plagiarism, because sometimes you may even be accidentally doing plagiarism and not even realize it, or incidental, what we call incidental plagiarism. So I try and provide you with instructor feedback so that way you can improve upon things, especially in this first few weeks. So make sure you're looking at that feedback when you're looking at graded information. All right, on the syllabus. And again, I'm not going to go into detail with this because I did so on the preview course session, but on the syllabus, it's located on the home. You can get it on the left-hand side under announcements, or you can go to the home button and it's next to the library button or one of those links. All right, so the first section goes over the course description and then the program outcomes. Next, it goes over the course learning objectives, as well as our resources for this class, which we've talked about is our lovely textbook, and you should have the 5th edition, so make sure that you do. If you do not have the 5th edition, it is your responsibility to align those chapters to the correct. Sometimes whenever they switch editions, they change the chapters of the information. So that's why it's important to make sure that you are following that, so you're learning and reading the right information. Next, this is just another way to get to your course modules. It lists each module out, and if you expand it, it gives you the topics that we're going to discuss and shows you the graded activities or the assignments that are due in addition to the points that are available for those assignments. All right. Next, the grading scheme, and this is an important one. So it does follow the nursing grading scheme, which means an A is 90 to 100, a B is 80 to 89.99, and anything below a 79.99% equals unsatisfactory, or an F in the course. So again, this is why I attempt to help you maximize your points by talking about the assignments during the synchronous sessions and offer that separate content session, because I want to make sure that you're maximizing your points. One thing I don't want you to do is get to the end of the course and realize you needed a half a point or a point to pass the course or to go from a B to an A. And once we get there, it's too late. So there's no going back on that. So making sure that you're maximizing it as we go along. All right, followed by the institutional policies. The important one to look at is the makeup policy. Again, I talked about this in the preview course session, but just making sure that you're communicating with me If you need to request an extension with those extenuating circumstances, please make sure you're emailing me an appropriate amount of time. Just reach out to me is all I'm saying. Communicate so we can discuss a plan and see what our options are. And then you have the university policies and finally the remote proctoring. All right, next, this is our Unit 1 objectives. So this week we are going to examine and incorporate the pharmacokinetic, pharmacodynamic, and pharmacogenomic concepts for pharmacological decision making. We're going to also explore and evaluate patient factors that impact pharmacologic decision making, examine the pharmacotherapeutic concepts that related to the care of the patient with respiratory disorders, and then finally explore and apply current evidence to pharmacologic decision making for the management. This is our reading and videos presentations that we have assigned this week. I do recognize that this looks like a lot of information. What I do want to remind you is this is an advanced course, meaning this is not the first time you've likely heard this information. When you're looking at the assignments, especially the reading assignments, look at and concentrate on the items when you're taking notes on the items that you are least familiar with, or maybe that you need to dive in deeper to. Okay. You're going to come across information that you're very familiar with. So making sure that you're spending the appropriate amount of time that is needed with that stuff that you are the concepts and, disease process medications and everything that you need to, okay, that you're least familiar with. So we are going over chapter 1, 2, and 3, chapter 7, 23, 24, and 46. So the first three chapters, chapters 1, 2, and 3, are kind of a review. The first chapter is going over the issues for the practitioner in drug therapy. The second and third chapter, we look at the pharmacokinetic basis of therapeutics and pharmacodynamic principles, and then looking at the impact of drug interactions and adverse events on therapeutics. And then chapter 7, we kind of dive into pharmacogenomics, and then leading into chapters 23 and 24, we look at respiratory infections, asthma, and COPD. And then in 46, looking at allergies and allergic reactions. You do have two global initiatives to look at. One is for COPD, the other one is for asthma. So please make sure you're referring to those. That might be something that you use as a reference because of those guidelines and everything that it discusses, as you know, and a helpful for maybe your discussion this week. So that might be one of your references that you need or might use. You do have videos and presentations to look at. There are 5, I believe. Yeah, 5. So making sure that you're watching these. You can speed the video timing up if you need to. You know, I like to listen and watch things in a speed level of 2. It's just my preference. So find your speed if it's available. You have the pharmacokinetics made easy, pharmacodynamics made easy, the pharmacogenomics, and then you're going to look at pharmacogenomics and genetics through introduction or thorough introduction. And then finally, looking at drugs for asthma and COPD made easy. All right, we're going to quickly look at our week 1 assignments, starting with our discussion, our 2 discussions, okay? So looking at discussion 1, this is just a simple introduction. So please make sure you're reviewing the instructions. You do want to make sure that you're doing this assignment. Even the assignments that are, you know, worth 0 points, they are complete or incomplete. So you must have everything completed in the course in order to be successful. So please make sure you are doing these assignments, even if they don't have points attached to it. So, the other example is that shadow health orientation doesn't have points, but it has to be completed. Okay. And they all do have the due dates. All right. So on that initial post for the introduction, it's just asking you to introduce yourself to the rest of the class, provide any information you'd like to share, including your academic or personal experiences. You know, it's lovely to learn about who you are, where you're from, what program you're entering or you're in, and why you selected it. I always find it interesting to learn. And this is how we can learn about each other. Okay. You do want to respond to 2 of your peer posts. Now, because we have 2 discussions due this week, your first, which is your introduction initial post, is due by Wednesday, which is tomorrow at 23:59 Central Standard Time. And then the discussion number 2, which is our management of an asthma patient, that initial post will be due on Friday. And then all of your peer posts will be due by Sunday at 23:59 Central Standard Time. And it is always good to make sure that you have, when we're talking about one discussion post, okay, or your initial and 2 peer posts for one discussion assignment, those 3 posts need to be posted on 3 separate days, okay, to maximize your points. So real quick on the discussion 2, management of the asthma patient. So our instructions are going to be very similar to the introduction one. And as we go throughout the week, when you come across discussions, these are the main instructions. So you're going to have on the initial post 250 to 300 words. And although your response to your post or to your peers don't have a minimum word requirement, they should be substantive and demonstrate topic knowledge and scholarly engagement with your peers. So you want to make sure you're covering all of the discussion prompts and elements or components for that topic. Make sure you proofread before you submit. If you have any corrections you need to do, just reply and correct it so that way, and just put corrected so that way I know which one I need to grade. We do not upload any attachments unless it is specifically asked to do so in the instructions, okay? All posts should be supported with a minimum of 1 scholarly reference. Now, with that said, or 1 resource, if you're utilizing the textbook, that is okay, but you need to have included as a reference as a journal article or clinical guidelines or something like that. Now, when you say this is the minimum, okay? So when we look at the rubric, I'm going to explain something further. That would be the minimum. It's not going to be the maximum amount of points. And so I'll go into details on that in just a moment. So on this assignment, we are looking at a 16-year-old patient diagnosed with asthma. And as you address the following prompts, you're going to look at providing your diagnosis, how you would manage the patient's current asthma regimen, and provide rationale to support those thoughts behind it. And that would include your citations, your scholarly references for that treatment plan. When you're including your specific prescriptions for this patient, every prescription needs to include the medication name, the dose, the route, the frequency, as well as any special instructions that may apply as you would if you included it in when you're writing an actual prescription, okay? This is different from the next thing that's asking you, which is to describe the patient education that you would provide in the relation to the treatment plan and those prescriptions. So think through that and make sure you're looking at what information needs to be provided. And then lastly, it's asking that you provide your plan for follow-up and or a referral if it's indicated. On your peer posts, it's asking you that you review the plans posted by your peers and from your advanced practice nursing role. So if you are an educator in the educator program, then you're going to come at it from that perspective. If you're going into a leadership program, then you're going to come at it from that perspective. Whether you're the nurse practitioner program, you're going to go from that mindset. You're going to reflect upon that discussion and then provide the feedback on that as such. So, for example, if you're a nurse educator, you're going to look at it from a clinical or academic. What are your thoughts about the patient education provided in the plan? Or do you have anything that you want to add to that education provided? And you want to make sure that you're, again, supporting all of this with references and appropriate citations. Now, quickly, let's look at the rubric. And this is what I wanted to talk to you about right here. So on the discussions, it's broken down into 5 sections. You have the content, analysis, collaboration, writing, and APA. When you look at this, the collaboration is the first part. So if you don't post on 3 separate days, you're automatically at 10 points. And if you look at here, it says and or postings are not submitted on a minimum of 3 separate days. So that's an automatic 2-point deduction. So just wanted to point that out. If you are doing a minimum reference, and that means you just did one scholarly reference in your textbook, okay, then you're likely going to receive a 9 or a 10 out of the analysis because you're providing evidence, but you're doing minimal or basic analysis and support. Okay. So if you go back to that discussion tips announcement, it did ask that you include a minimum of 3, usually 3 to 4, that will get you that 12 points. Okay. And I would keep it around that 3 to 4 because for the discussion topics that we have, that should suffice. Okay. The content is going to mean you've addressed all the prompts appropriately. And then finally down here, the writing and APA. This is where you're going to lose points for APA. Now, I will say in the writing, if you have issues there, I will say if there are validity issues with your references, and what I mean by that, you don't have appropriate citations, your DOIs are not listed, your URLs are not listed, your links those links that you have on there, the DOI links or URL links, lead to the wrong articles. They have function issues, they're broken or something like that. Then this is where you will receive zeros on the writing and APA. But I want to point out that it does lead into issues here where you can receive zeros on the entire assignment, because it is very important that you have everything supported appropriately with your either quotations or supporting in-text citations. So when you start to have issues with validity, this is where it leads to issues that you could receive a 0 on the entire assignment. So I will provide you with a great deal of instructor feedback. So you should be very familiar with where you have, where those mistakes happened. If you have questions, don't hesitate to reach out to me. Okay. Let me go back here. All right. Oh, dang it. So sorry. Let me get through here. Goodness gracious. The next thing we're going to look at as I click through this is the quiz. So, son of a gun. Just a moment. All right, there we go. So on the Unit 1 quiz, it is due by Sunday, 23:59. And each week you will have a quiz. It is a timed quiz, so you have 30 minutes to take the questions. You'll have your due date. Don't wait until the last day is what I would recommend in case something pops up. If you have computer or technical difficulties, that's why I'd rather you take it earlier so you're not finding all of this out and causing more undue stress before you take this. Okay. It is auto graded. Each quiz, once we surpass that due date and everyone has taken it, then the collective courses, so all of the courses that are sections that are in this course, there is an analysis done. So if there's a question that is thrown out, I will communicate that. You have about 90 seconds per question. So think of that. There's only one attempt for each quiz. Making sure you can't backtrack, so you can't go backwards. So making sure that you do answer the question before you move forward. If you start the quiz at 11:50, that means you only have 9 minutes. Once you hit that 11:59 p.m. Central Standard Time, everything not answered from that time will be a 0. So please make sure you're giving yourself sufficient time to do that. Okay. All right. Week 7, I wanted to mention this because I want you to go ahead, and I said this, I think, in the preview course session as well, but I want you to go ahead and access and get onto the site to make sure that you have access to this site and this specific education that is required in week 7. So you're going to go to the README first and go to the MSUD medications for substance use and opioid use disorder. When you get there, you're going to go to this link and click on it. It will then lead you to the APNA e-learning center. You're going to click on the register button, and that register button will take you to an option to get registered. It will then go to your email and allow you to access and come back to access this learning center. Once you get access to it, and sometimes it takes 24 hours, I think is what it says, but give it just a day or two. If you don't get it in your email, you'll have to contact the IT or online support through this website. I do not have access to this. This is through American Psychiatric Nurses Association. It is free, so you need to make sure that you're going through the course in order to access this information. You should not have to pay anything. This is all a free learning center. You're going to access this MSUD training, medications for substance and opioid use disorders. This is a week 7 assignment. I'm telling you now that it's wonderful for you to go ahead and log in and then just start to complete it now, so you're not doing it all in week 7. Week 7 is a busy week, and this assignment takes about 9 hours to complete because there's modules and videos to watch, and each one, so you can see the module 1 overview is 63 minutes, and you have to complete it before it unlocks this evaluation. And then so forth. So each one, after you're completed, it's done. So if you do a little bit each week, it's much better than sitting down and doing it for 9 hours at the end of the time. Okay. Afterwards, you'll get a certification that shows that you've completed it. For nurse practitioners in the program, you need to hang on to this certificate. So make sure that you are downloading it to your to a jump drive or to your desktop, whichever, but you're also going to use it as a submission for your assignment. Those of you in other programs, you are going to use this and save it to your desktop because you will need it for your continuing education later on in the program, but also as a submission for this link as well. So that is one thing you need to do. If you're in the nurse practitioner programs, it does require you to go through here, and you can see the README first. It says NP students only. Now, I know that says NP students only. That's referring to the information about the exam that you guys will have to take. The other students that are in other programs, you can go in here because this does offer you a study guide, and this is the only study guide that is offered in this course. So this is how you would access it. This is another great way to access that library link to the resources, the 3 Ps, those 4 ebooks that they offer. Okay. But I wanted to point that out just to make sure that you saw that. All right, thank you so much. I know that was a long one. Typically, our synchronous sessions won't go as long, but there's a lot of information I want to cover and make sure that you guys have access to. Reach out if you have any questions or concerns. I'm happy to answer those. And remember, the best way to contact me is through the course in the inbox through my email. Thank you so much.